Hello, I'm Dr. Sabine ZENKER, a dermatologist from Munich, Germany. We will showcase you today the Pluryal filler range hyaluronic acid fillers. So we'll assess the patient first. When one looks at her face, she's remarkably without wrinkles, but volume loss starts to show. So typically this line engraves over time. So what we'll do for her is to soften a bit this transition between the cheek and the perioral area in this upper part, as well as kind of rebuild the transition from the cheek to the prejowl sulcus and the chin in order to make her look a bit more rebalanced actually. What we then do, and this will all be done with Pluryal volume, what we then will do is redefine the red-white border of the lip. We will invert this line a bit and give her a bit more of a kind of rejuvenated look of her lips. So we will treat the nasolabial fold with actually a 25 gauge blunt cannula, 1.5 inch, and we do the entry point with a 23 gauge needle. Then we have to prep the cannula, never inject air. I hold the syringe as a screwer, stretch the skin, insert the tip of the cannula, and then I do insert the cannula in the subdermal plane, pointing medial. You see the subcision-wise disruption of the tissues. This is how it should be. Then I control the tip of the cannula, which is here. I have pointed the cannula down in order to have the hole on the tip of the cannula pointing down, and now I do aspirate for a little while in order to avoid any complication, and now I do withdraw the cannula and do place the Pluryal hyaluronic acid in a gentle way, in a retrograde fashion, putting a thread in the subdermal plane. Second pass is pointing a bit more medial here to build up the volume she's losing on her upper lip, as well as one last pass going all the way around the mouth, actually to give her back frontal projection one does lose over time by changing of the positioning of the teeth and again the soft tissue loss. So this is how the nasolabial is done. Second, again with the cannula, will be the prejowl sulcus. Insertion point, entry point is in front of the jowl, in front of the artery, the facial artery, in the subdermal plane. If there's a resistant, redirect your equipment, redirect the cannula. Now the control, again, the tip of the cannula, which is exactly at the red-white border of her lips, and do the foundation, rebuild the volume in the deep subdermal plane. It's like building a house, giving back the support the soft tissues do lose over time. I do inject fanning-wise in a retrograde fashion using Pluryal volume. As for now, I used 0.8, about a mil overall in this area. I do then mold the area. So this was the first step, the foundation. When it comes to the more superficial layers, we use Pluryal hyaluronic acid filler. And for this purpose, we do, as it comes to the more sensitive area, because we do the labial line, we do mix Pluryal with xylokin 1% in a 20% ratio. We do 10 passes each side in order to mix the filler well. This is an off-label use. I do use for either sensitive areas or delicate areas, such as the perioral one certainly is. I do now layer the Pluryal over the Pluryal volume to fill the line with a sharp needle, a 30 gauge needle. This is purely subderm. I use a retrograde fashion linear threading, and I fill the little lines I can see around the mouth. I do now rebuild the corner of the mouth. I needle up the red-white border here and do again a threading-wise injection along the line. So the technique here is to hit the tunnel which forms the red-white border with a 30 gauge needle and inject like a centimeter apart, and then you can see that the material flows all along this little channel. So and we want to evert now the product is here. So with this technique I can avoid multiple injection points, and the material comes directly to this border and everts the border ideally. It's a very superficial injection directly to the line in a blanching wise way. One can blanch with this filler. It doesn't tindle. It does not have the typical side effects. It doesn't get lumpy. The little lines here we do point by point all along the little line. the rebuilding of the lost volume and the lower levels, we will continue with the lip here. Overall, we did rebuild the perioral volume of the patient with a Pluryal volume 2 ml in a total, and we did redefine her red-white lip line with Pluryal 1 milliliter and lift up her coldness of the mouth with the same product.